Good afternoon. This is Dr. Ashwini Kumar speaking to you. We will be discussing lung abscess, which means collection of pus in the lung parenchyma. Lung abscess is a necrotic area of lung parenchyma inside a thick-walled cavity containing purulent material which may be expectorated only if it is communicating with the bronchus. What is the etiology? The usual etiology is aspiration of nasal or oropharyngeal contents into the lung. This is usually caused by a depression of the cough reflex as occurs in anesthesia, sleep, epilepsy, coma and alcoholic intoxication. Also due to achalasia cardia, hiatus hernia, carcinoma of the esophagus, large volume tube feed and GERD. The source of infection can be either a sinusitis or a oral or dental sepsis. The usual organisms responsible for infection in a lung abscess are aerobic organisms, Peptostreptococcus, Prevotella, bacteroids and Fusobacterium, and also Streptococci and Haemophilus influenzae. Because of the more vertical course of the right main bronchus, aspiration producing an abscess is more often seen in the right lung. Bronchial obstruction can lead to lung abscess distally. What are the symptoms due to lung abscess? The onset of the illness usually acute with high-grade remittent fever. There can be chills and rigor, pleuritic chest pain and cough. If the abscess ruptures into a bronchus, suddenly the patient starts expectorating large quantities of sputum. The sputum is large in volume, often purulent, foul-smelling and blood-stained. The quantity may be variable depending on the posture of the patient. Usually there are symptoms lasting for more than a month. Abscess due to aspiration is often of long duration. Insidious onset of low-grade fever, anorexia and malaise may occur, and there can be weight loss and deep-seated chest discomfort. What are the signs in case of a lung abscess? The patient is very often young or middle age, but can be either a male or a female. Anemia may be there. Clubbing is very common and it can occur as early as 2 weeks after the onset of the illness. Patient may be having halitosis and as a result oronasal sepsis. Fever of high-grade remittent nature is almost always present. The respiratory system may be clinically normal in the early stages, but if the abscess cavity is deep, small or filled with pus and non-communicating, clinical findings are likely to be absent. Later, patient may present with the features of pneumonia or pneumonic consolidation. There can be dullness on percussion and tubular bronchial breathing, as well as increase in vocal fremitus and vocal resonance. Signs of cavitation are usually either a cavernous breathing if it is a large cavity with a large communication to the bronchus, or a amphoric breathing if it is a narrow communication. Sometimes post-tussive crepitations are also heard. Now, what are the complications of a lung abscess? Lung abscess can lead to acute septicemia, that is dissemination of the bacteria into the bloodstream, and chronic ill health can occur. Sometimes this can result in empyema thoracis. Hemoptysis can occur, and it can be massive hemoptysis, the patient bringing out liters of blood. Just like empyema thoracis, you can also develop a pyoneumothorax, which is collection of pus as well as air in the pleural cavity. Now, the lung abscess can get metastasized to the brain and produce a metastatic brain abscess. Sometimes secondary fungal infection can occur and form a aspergilloma of the cavity. There can be a fungal ball inside. Sometimes lung abscess can lead to chronic amyloidosis. Recurrent lung abscess can lead to residual fibrosis of the lung. In some cases, there may be associated bilateral bronchiectasis due to spillover of the bacteria into the bronchi. What are the other causes of pulmonary suppuration? Pulmonary tuberculosis may cavitate and have secondary bacterial infection. Hematogenous spread can occur with secondary infection of the cavitating malignancy or a pulmonary infarct. There can be a rupture of amoebic liver abscess into the lung as well. What investigations will you do? You will do a blood routine, hemoglobin TCDC ESR, anemia, polymorphonuclear leukocytosis, and there can be very high ESR. Chest X-ray usually shows a homogeneous opacity of round or oval shape in the upper or middle zone of the lung without any air bronchograms. The wall of the lung abscess cavity can be seen all around, and you can see a horizontal air fluid level. The sputum should be sent for gram stain culture as well as Seal-Nielsen's staining for acid fast bacilli. Now, number of polymorphonuclear leukocytosis is always elevated upon microscopy, and gram staining may identify the organism. The culture of the sputum may reveal the causative organism and the antibiotic sensitivity. Accordingly, you can add the antibiotics. A CT of the thorax may localize the cavity more accurately, and therefore it is better than a chest X-ray in planning and assisting in postural drainage. How do you manage a case of lung abscess? Antibiotics are chosen as per culture and sensitivity of the sputum and blood culture if available. Usually you can start the patient on crystalline penicillin along with the gentamicin, or you can use a combination of ampicillin and gentamicin. Anaerobic coverage is usually to be given in the form of injection metronidazole 500 mg intravenously 8th hourly or 400 mg orally 3 times daily. The next most important aspect of management is postural drainage and chest physiotherapy. The patient will have to be placed with the lung abscess cavity above and chest tapped. A steam inhalation followed by positioning of the patient in a tilting table is ideal so that the abscess cavity is at a higher level. If it is not relieved with the above measures, you can opt for a surgical procedure for lung abscess. The choice will be a percutaneous aspiration of the pus in the lung abscess cavity. And you can place a pigtail catheter to drain the abscess. The abscess cavity may be there for 3 to 4 weeks, so such a prolonged drainage may be required. What is the prognosis and outcome? Acute life-threatening condition, lung abscess. Therefore, you need prompt treatment.